Statistics of Spanish SLI, or language impairment. If you're not bilingual, you still need to be aware of these issues to work with families, paraprofessionals, and so on. And if you're bilingual, you're going to be working with some of the issues. So we're going to talk about how we provide services when we have the language and when we don't have the language. And then how to think about goals. And there's nothing. Whoops, what was that? Okay, so service delivery. So please bring me your questions as we go along. Did the online people say if they're bilingual? I don't know, can't tell. Okay, so what are the different service delivery modes? We have when one person provides all the services and that person is bilingual. So there is that hopefully you have those, but there's not many of those. Those are few and far between in every district that I've been familiar with. But the big danger for the bilingual person, and let me know if that's an issue for you, is that you end up having to do the translation of the IEPs, all the case coordination. You become the interpreter sometimes for the school system or for the school. And your caseload could be outrageously big when you're having to spend 2-3 more hours in an assessment that you would with a monolingual child. Okay, so it's ideal, but there has to be some type of job protection. Some of the bilingual SLPs that we've trained and that we work with have become very strong advocates of those positions, making sure that they don't become the translator for an interpreter for their school. That if they need an interpreter, they can't keep pulling them out of their services to interpret for them, and that they're not having to translate all those IEPs. That's hours on end. Okay. In other school systems, the bilingual service SLP does the assessment and establishes the intervention, but somebody else implements that intervention, okay? In some cases, the monolingual clinician does the English assessment, the bilingual clinician does the Spanish assessment, and then depending on what the child needs, they both provide services, or bilingual aid provides services, and so on. So there's many different models, and I'm not sure which models you're working with. It's possible that in some cases the resources aren't there. So one of the things I like to see is some home programs, although implementing home programs is not easy, partly because I know if their parents work like I do, whatever it is, just coming home to do a home program with your child on top of homework and taking care of a household is very difficult. So it's a little bit complicated, okay? But they can be reevaluating and looking at the program on a regular basis. If you're a monolingual speech pathologist and you're working with a bilingual assistant or paraprofessional, hopefully it's a relationship that develops, okay? What happens is when there's these less common languages, you get an interpreter from some other community that drives in, tries to interpret for you in a language. You don't have time to develop relationship, and it's a lot more difficult to work at that type of level, okay? Often those kinds of interpreters are not going to work with you in terms of interventions, mostly assessment and diagnosis, but not intervention, okay? So basically, you're going to have to deal with the training. In a school system I worked in Massachusetts, the paraprofessionals didn't have more than high school degrees. So and I don't know in some places how it is, but that in itself presents a problem in terms of how much information they have. And if we follow ASHA guidelines, they should actually have a bachelor's degree, okay? You need time for meetings before the session and after the session. So pre-brief and debrief is very important in your assessment. And then once you move to the intervention side, you need time to meet regularly and go over the goals. One of